Hi, this is Jennifer Hugh. I'm part of American Public Health Association at SUNY College of Optometry, and we're here with Dr. Melvin Shipp. He's been a member of the National American Public Health Association for over 25 years. He's been on several boards on the Food and Drug Administration. He's been a part of National Eye Institute, where he was on the planning committee for the National Eye Health Education Project, which was a nationwide program to help prevent blindness through education. He is an OD graduating from Indiana University. He also got his MPH from Harvard University and got his doctorate in public health at the University of Michigan. And he serves as the current dean at the Ohio State College of Optometry and has been recently elected as president of the National Organization of Public Health. So welcome, Dr. Shipp.
I suppose I've done what I've done by serendipity. I kind of stumbled into optometry. My examination as a young child, I was impressed with the person who provided the eye examination for me. I thought perhaps I'd like to be like him when I grew up. And the more I learned about eyes, the more I felt that that was the thing I wanted to do. And indeed, I did go to Indiana University, completed my OD degree there, and following graduation, served in the military for a time. Well, I looked carefully at the schools and colleges of public health at the time. And again, with the idea of having the broadest exposure I possibly could, I chose a program that allowed me to do a general MPH as opposed to doing an MPH or a Master's of Public Health with a very specific focus.
We're really proud to have an optometrist in such a high position and play such a big role in public health, because I feel like it's often overlooked, especially in such a specific field that we're studying. So we're glad that you're able to kind of paved that way for us.
Well, I'm delighted to have the opportunity, and I'm looking forward to it. Well, I hope to, again, bring a better understanding about optometry in our profession, what we have to offer, what we bring to the public health arena. I recently was invited to the state of Maryland, met with the lieutenant governor there, and as well as was introduced on the the floor of the House of Delegates and the Senate, and made testimony before the health committees for those two bodies, and talked about public health as relates to the Affordable Care Act, and talked about the issues that are important for our country going forward and how we need to make better use of the resources that are available to us. And it was also an opportunity for me to talk about the fact that although there's a projected shortage of physicians in the near future, and that in and of itself could impact the ability to implement the Affordable Care Act. My comment was, well, we need to think not so much of a shortage of physicians as not making the best utilization of the providers who currently exist. And I use as example nurses, nurse practitioners, for example, and also optometrists, who are trained, all of us, to provide care at a very high level, and in many states are not allowed to perform at that high level. So underutilized resource, and brought that to the attention of the decision makers. And this eureka moment where they seem to appreciate the fact that, as opposed to worrying about creating more MDs per se, making better use of the other disciplines that could in fact help provide healthcare services in the country.
How have you used your education and your advanced degrees in public health to apply that to your work?
Well, my dissertation with my DRPH was an effort to try to tie vision into one of the most severe health outcomes that there is, death, which seems kind of a stretch. How do you tie in vision to death? Well, I used the vehicle of traffic studies and looked at vision as it relates to elderly drivers and the frequency with which they're involved in traffic fatalities. And it was an interesting study. I got a dissertation and a degree from it, but more importantly, I was able to take the information that I found and share it not only in this country, but also in countries abroad. Italy, in South Africa as well. So it was nice to have an opportunity to, number one, finish that degree, but also take the information that I learned from that experience and share it just in this country abroad.
And just use it to educate people. And
yeah.
So we're going to turn it over to Elsa.
Right now, we're trying to set up these presentations about glaucoma awareness at senior centers. So, like, in addition to those types of things, what would you like to see students doing in the public health arena? And what are some of the things that you guys might be doing at Ohio State that we might be able to adapt here at SUNY?
One of the challenges we have as a profession is that optometry is not terribly well understood.
Yeah.
So one of the things that the students could do that would help our profession, and I think even the individual students, is to make sure that we are fully integrated in the healthcare delivery system, that we're understood and appreciated for what we bring to the table. And of course, we can talk about that. We know that, you and I, but not everybody else understands what optometrists do. The way people find that out is not necessarily by us talking about it, but rather by doing it. So if in fact there are opportunities for optometry students or optometrists to be involved with other individuals who are involved in the healthcare delivery system, that's a good thing. Whether it's a general screening project where maybe you're doing something in the community or abroad, and you're elbow to elbow with other health providers, and they start to appreciate and understand what we do and how we can assess things that they are unfamiliar with or unaware of or unable to do. That's important to do. We have to not be shy about informing people about what we bring to the table and what value we bring to the table for individuals and their communities. Public health is actually a huge umbrella. It encompasses any aspects of health care, which is what we do primarily. And sometimes we think as clinicians that that's a little far from what we do. But if you look at the leading causes of death, heart conditions, hypertension, during the course of the eye examination, we have a very good appreciation of what the vascular system is all about. And for a patient who manifests signs of arteriolar narrowing or vascular changes, we know that that person might be at risk, and we would get them into the healthcare system that would address that need. So that's out and beyond the eye. And I guess if I had any message to leave to you and your fellow students, is that I would encourage you to think beyond 2020. So what someone sees 2020, what does it mean for them? Well, it means that they can do a job.
Right.
Or they can perform a task, or that they can learn. We optimize them performing in life, not just 2020, but what does that mean in terms of their quality of life and the things that they can do. Well, I'd just like to conclude by saying, number one, thank you for the opportunity to speak with you. And I would hope that through the process of listening to this piece, that there would be an understanding that there's not a either or circumstance with respect to optometry and public health. They are one and the same.